I welcome you to the HMC Tobacco Control Center in the state of Qatar. We have achieved a lot during the past 17 years. We start as a clinic, then a unit, now become Tobacco Control Center with different specialty. Also recently, we designated as WHO Collaborative Center, and it is the first one in the GCC area. The center is based on 4 pillars: preventive side, curative, research, and the training. On the treatment side, we offer all medication for our community free of charge, plus consultation. Also on the research, we collaborative with either national, international, and the local. We do a lot of community awareness engagement for the whole population, school, university, and the community. In the training, we offer different workshops for the health worker, physician, nurses, so we'll be able to increase the knowledge, attitude of those patients to improve, and that will be reflected in our service.
Being just a physician, we face a lot of patients with chest diseases, of course. Most of these diseases may be related to smoking. And since we're faced with a lot of patients who need special attention with intensive advice and counseling about cessation, we feel that referring those patients to a smoking cessation clinic under the Tobacco Control Center has been an added asset and benefit to the care of the patients. So we're utilizing this service extensively, and we also find the beneficial effect of such service in our patient in making the success to quit smoking among our patients much higher than we could achieve before.
Since one of the main objectives at the center is prevention, we focus our efforts on awareness by targeting different populations in the community. This includes school visits, lectures and workshops at public and private companies, ministries, as well as direct outreach activities that serve the community at large.
We adopt in the center multidisciplinary approach in the treatment of the smoker. So we have physician specialized in smoking cessation, we have psychologists, nurse, health educators. All this will help smoker to quit smoking. Plus, we provide all necessary medication on the machine. We have CO monitors, we have spirometer to measure the lung age and the lung volume. We have laser machine, so all the equipment will be help the patient to quit smoking.
Tobacco smoking in all of its forms, cigarette, shisha, suwaika, midwakh, is a growing epidemic in Qatar and needs further attention and increased enforcement of policy implementation. Research is one of the core activities of the Tobacco Control Center. Dr. Ahmad Al-Mulla leads and collaborates on research at the national, regional, and international level. Al-Mulla and his colleagues have published more than 20 articles in peer-reviewed academic journals. Our mission is to prevent death and disease from tobacco products by generating evidence to support effective control interventions in Qatar. Our ultimate goal is to adopt an informed response to this preventable epidemic in Qatar.
The prevalence of the smoking in Qatar is around 30% of the adult population. And the starting age for the smoking is at 12 years of the age. To update our data, we will conduct the new study this year, which we target 6,000 sample size to update the knowledge attitude of our local population.
My name is Nizar Kalaji. I am 57 years old. I was smoking for over 31 years old, 40 cigarettes a day, which means 2 packets. And in 2011, I had a stent implanted in my heart, and I was advised to stop smoking. So I heard about the Tobacco Control Center through a friend of mine, but I didn't believe in this idea because I didn't believe that a doctor or a medical center can make me quit smoking with medicine or anything. But at the end, I took the advice. I just visited the center, and they started treating me. They welcomed me in a good way, that they encouraged me and they built confidence with me initially. Then they started with their medication and explaining the disadvantages of smoking for your body, and they gave me medicines and they gave me their advices, and I followed their instructions, and I quit smoking with their help, totally with their help. I advise any person, any smoker, is to visit the center and try to quit smoking and to fight this habit, which is, I think, is the cancer of this generation.
The center provides accessible and free of charge service of the smoking cessation for the whole community. We're going to conduct workshop for the health worker and the physician, not only in Qatar, but in the all EMRO region. We aim to work with other health institutes around the world in the research area in the field of tobacco control.
After I quit smoking, my health became very good. I started breathing well. I started to walk, jog without getting tired. And socially, it's different. Socially, I sit with people. Socially, I don't leave people after meals. I don't have to get out of the mall. This is one of the best advantages I gained from quitting smoking.
Welcome to Hamad Medical Corporation Tobacco Control Center, WHO Collaborative Center.